Hi. Are you Nicole?
Yeah, I'm Nicole.
Hi, Nicole. I'm Julia.
Hi, nice to meet you.
Nice to meet you. I'm the clinician that's going to be administering the cranial nerve exam today.
Okay.
Do you have any pain?
No.
Any concerns?
None.
Okay. Great. Well, let's get started.
Okay.
This exam is testing cranial nerve 1, the olfactory nerve. In this examination, the clinician will present the patient with a well-known scent. In this case, orange and lavender essential oils will be used. The patient is asked to occlude one nostril at a time and inhale through the nose. If the patient is able to distinguish between the scents, this is an indicator that the olfactory nerve is intact. If there is damage to cranial nerve 1, the patient would not be able to identify the scents, an association of anosmia.
Have there been any changes in your smell?
I don't think so, no.
Okay. Well, I have two familiar scents, and I want you to close your eyes and close one nostril and breathe in. Tell me if you can smell this.
Mm-hmm.
Can you identify the scent?
Orange.
Good. Okay. I have another one, and I'd like you to cover your opposite nostril.
Close my eyes.
Cool. Breathe in. Can you smell that?
Mm-hmm. Lavender.
All right. Very good.
This next exam will be testing cranial nerve 2, the optic nerve. In this video, we will only be testing the measurement of visual acuity, pupillary light reflexes, and the visual fields. We will start off by measuring visual acuity. The patient is asked to cover one eye at a time and identify letters from the Snellen's chart at a distance. This procedure tests the macular, which gives the rise to the majority of the optic nerve fibers. If there is a lesion to the macula, it will result in significant loss of visual acuity.
Okay, I'm going to test your vision. I'd like you to cover your left eye and see if you can read the chart behind me. Okay. See if you can read line number 9.
Leftopdpot.
Okay, cover your other eye.
Same line.
Same line, please.
Leftopdpt.
All right, thank you.
Next, the clinician will continue to test cranial nerve 2 by testing the visual fields of the patient. In this procedure, the patient is asked to focus on the clinician's nose and cover one of their eyes. The clinician will cover the opposite eye and extend their finger out of view of the periphery. The patient will be asked to respond when they are able to see the clinician's finger as the clinician moves towards the visual field. This will be repeated in all 4 quadrants. If the patient fails to see the clinician's finger, it is an indicator of a visual field deficit. Finally, to test the pupillary light reflex, the clinician will finish this portion of the exam by shining a light in the patient's eye to test the pupillary reflexes and make sure each pupil is dilating appropriately. This test will examine both the sensory in cranial nerve 2 and the motor aspect in cranial nerve 3. If both of these pathways are intact, the ipsilateral and contralateral pupil will constrict. Failure of proper pupillary constriction indicates a lesion of cranial nerve 2 and cranial nerve 3.
Okay, Nicole, I want you to focus on my nose and cover your right eye. I'm going to cover my eye as well. Let me know when you can see my fingers, okay?
Mm-hmm. I can see it.
Okay. And again.
I can see it.
All right. Now switch eyes. Let me know when you can see my fingers.
I can see it. I see it.
All right, great. All right, Nicole, can you take off your glasses, please? I'm going to shine a light in your eye to test your pupils, and if it gets uncomfortable, let me know. Okay?
Mm-hmm.
This portion of the exam will test cranial nerves 3, ocular motor, 4, trochlear, and 5, the abducens. The clinician will be checking the movements of the patient's eyes as well as eyelid position. The clinician will instruct the patient to follow her finger with their eyes in different directions while keeping their head straight. Failure to do this appropriately is an indication of a lesion in cranial nerve 3 and may result in lateral and medial strabismus. Any drooping seen in the eyelids may be indicative of ptosis. A lesion to cranial nerve 4 will result in the eye deviating superiorly and laterally.
Okay, Nicole. I want you to keep your head straight and follow my finger, okay, with your eyes. Good.
This exam will test cranial nerve 5, the trigeminal nerve, which is split into 3 regions, which include the forehead, the ophthalmic nerve, the cheeks, the maxillary nerve, and the jaw, the mandibular nerve. These regions will test for the bilateral presence of discriminative touch, pain, temperature, and simple touch. The clinician will look at motor movements in the patient's jaw by asking them to open and close their jaw to observe appropriate symmetry in both directions. The jaw will deviate ipsilaterally towards the weak side when there is damage in the mandibular nerve. To begin testing for sensory issues in cranial nerve 5, the clinician will first use their fingers or a cotton swab to test tactile sensory in all 3 regions. Next, an object with sharp and dull end, like tweezers, will be used to test pain and discriminatory touch. Finally, a hand warmer will be used to test the feeling of temperature in these regions. Failure to discriminate these sensations will indicate a lesion in cranial nerve 5.
Okay, Nicole. I want you to tell me if you can feel this.
Mm-hmm.
Okay. Can you feel this?
Yeah.
Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Can you feel this? Can you feel this?
Mm-hmm.
Okay. I want you to open and close your jaw for me. Okay. And again. Great. Do you feel any pain?
No.
Okay. Give me your hand. Can you tell that this is dull? And this is sharp?
Yeah.
Okay. I want you to let me know what you feel on your face.
Sharp. Dull. Dull. Sharp. Dull. Sharp.
Great. Okay, have a heating pad. Can you touch that with your hand and feel that it's warm?
Yeah, it's warm.
Okay. I want you to tell me if you can feel this on your face.
Mm-hmm.
Great.
This exam will test cranial nerve 7, the facial nerve, which is associated with the facial expression, taste, lacrimal, and salivary glands. In this examination, the clinician will ask the patient to raise their eyebrows and crease their forehead, close their eyes and keep them shut against resistance from the clinician, puff their cheeks and hold it against pressure, and smile with teeth showing. Finally, the clinician will ask the patient to clench their jaw to see if there is a tightening of the jaw muscles. This exam will observe facial expression along with muscle symmetry. If there is a lesion to cranial nerve 7, this may be indicative of Bell's palsy, ipsilateral paralysis to facial muscles. Cranial nerve 7 is associated with taste from the anterior or back 2/3 of the tongue and salivary glands. The clinician will swipe a sucker across this portion of the tongue and ask the patient if they can taste the flavor. Ipsilateral loss of taste in this area is known as ageusia.
Okay, Nicole, let me have you remove your glasses and look at me and raise your eyebrows. Okay, and one more time. Great. And can you squint your eyes for me? Okay, great. And open them. Okay, squint them, and I'm going to hold my hands here and try to resist. Don't let me open them. Great. All right. Puff your cheeks out and keep them. Great. Smile real big and show me your teeth. Perfect. And clench your jaw. Okay, clench it again. And one more time. Great. I have a sucker here, and I'm going to test the back portion of your tongue. So stick out your tongue for me real big. Can you taste that?
Strawberry.
Great. You can have this later.
Thank you.
This exam will test cranial nerve 8, the vestibulocochlear nerve, which is associated with both hearing and balance. The clinician will perform the Rhine and Weber tests using a tuning fork to assess whether the patient has a conductive or sensory neural hearing loss. For the Rhine test, the clinician will place the sounding tuning fork on the patient's mastoid process and then next to the ear. After this, the clinician will ask the patient which sound they heard the loudest. If the patient has normal hearing, they would say the second position was louder. Next, the Weber's test will be administered by placing the base of the sounding tuning fork on the patient's forehead and ask them to distinguish if it's louder on either ear. Indicator of a normal hearing is when the patient heard the sound on both ears. If a tuning fork is unavailable, the clinician can use their fingers by rubbing them together to make a light noise. In this procedure, they should start first by the patient's ear and ask them to indicate when they can no longer hear the noise as they pull their hand away. Lastly, the clinician will instruct the patient to test their balance by standing first on their right foot only and then on their left for up to 8 seconds. A lesion to cranial nerve 8 will result in ipsilateral deafness and a loss of balance.
Okay, I'm going to ping this tuning fork, and I want you to tell me where you hear it the loudest, okay?
Okay. Second one.
Second place?
Mhm.
Okay. I'm going to do it again and place it on your forehead, and I want you to tell me which ear you hear it the loudest in.
Okay. Both sides.
Both of them.
Yeah.
Great, perfect. Okay, Nicole, can you hear this?
Mhm.
All right, I want you to tell me when it fades away.
Okay.
Okay. Can you hear it over here?
Mm-hmm.
Tell me when it fades away.
Yeah.
Okay, great. Okay, Nicole, I'm going to test your balance. So I want to have you stand up. All right. Can you balance on one foot for me, please? Hold it. Great. And again with the other foot. Perfect. Thank you.
This next part of the exam will view cranial nerve 10, the vagus nerve. Cranial nerve 10 is usually tested in conjunction with cranial nerve 9, the glossopharyngeal nerve, by gag reflex assessment. However, in this video, this procedure will not be administered. To test for abnormalities, the clinician will begin by examining the patient's resting posterior pharynx. A unilateral lesion of the nerve will result in lowering or flattening of the palatal arch towards the damaged side. If there is no noted lesion, the clinician will instruct the patient to say "ah" with their tongue slightly sticking out. This method will contract the superior pharyngeal constrictor muscle. Damage will result in the uvula deviating to the undamaged side.
All right, Nicole. Open up your mouth and say "ah."
Great.
This portion of the exam will test cranial nerve 11, the accessory nerve, which is associated with the sternocleidomastoid and the trapezius muscles. In order to test the function of these muscles, the clinician will place their hands on both of the patient's shoulders and ask them to shrug them up and down simultaneously. Next, the clinician will place their hand on the patient's cheek and ask them to rotate their head into the clinician's hand. They will then do this on the other side. A lesion to this cranial nerve will cause ipsilateral deviation of the shoulder and contralateral head rotation.
Okay, Nicole. I'm going to put my hands on your shoulders. Raise them up for me. Great. Okay. And turn your head into my On this side? Perfect. Good job.
Lastly, the final exam will test cranial nerve 12, the hypoglossal nerve, associated with muscles involving the tongue. The clinician will place one of their hands on each of the patient's cheeks, one side at a time. The clinician will then ask the patient to keep their mouth closed and push their tongue against the hand. If the clinician can feel sufficient tongue movement and pressure, it is an indicator of normal functioning nerve. A lesion to this nerve would cause ipsilateral deviation to the damaged side as well as muscle fasciculations.
Okay, Nicole, stick out your tongue for me. And can you move it from side to side?
Great.
I want you to push your tongue up against one side of your mouth and try to push against my hand.
Great.
And on the other side, you push against my hand. Perfect. Well, Nicole, thank you for coming in today. I'll look over the results and send you an email in the next few days. Do you have any questions for me?
No questions right
No?
now.
All right, well, thank you for coming in today, and don't forget your sucker.
Okay, thank you.
Bye.
Bye.